Hi guys. So this is my second video on borderline personality disorder, and I want to talk about treatment a little bit because my last video was just describing the problems of it, and I want to show you that treatment is possible. So first, and the most urgent and thing that it usually happens first is that after you admit that you have problems, because this is the step number 0, you are prescribed some kind of medications. And although there is not yet a medication invented to treat borderline personality disorder specifically, I should start saying BPD. I will say BPD from now on. But they treat the symptoms. So usually people with BPD have depression as a co-occurring condition, so they are usually prescribed antidepressants. Then there are antipsychotics and mood stabilizers in order to reduce the electrical activity in your brain, because a little bit like with epilepsy, when you have borderline personality disorder, it's just your signals in the brain become very chaotic and very fast if you feel strong emotions, so you can very easily switch on and get out of control, and this is what these drugs are for. And they're tranquilizers, and I think that they're not used every day, but only for days when you feel especially bad or emotional or troubled, so that you can just take a tranquilizer and go to sleep in order to prevent bad things from happening. The second thing is therapy. So medication is there basically for you to feel better and to increase the quality of your life for the time when you will be in therapy. And it can be either inpatient if you are a danger to yourself or to others, or if you want to stay in inpatient therapy. And it's probably more effective if you are under control for most of the day. So what I found the most helpful were cognitive behavioral therapy and dialectical behavioral therapy. Cognitive behavioral therapy is an older one, and it's not only used to treat borderline, but it is quite effective. So I was doing this with my doctor, and basically it is just working with your core beliefs and things that you think when something happens, so your thought patterns that are usually a result of your troubled upbringing or your developments that didn't go the way that it should have gone. So it's like reprogramming your brain, basically. I have to say that if you just think that you will go to your doctor once a week or once a month or whatever, and just go there and then not do anything at all after and before that, well, you are wrong, and it will make your healing way longer than it could be. So I found very helpful to always do your homework, because your doctor will give you homework. And I had this diary where I had to put my thoughts and emotions and rank them on a scale of 1 to 10. And it was really annoying, because I am a person who doesn't like when people invade their personal space and try to get what I'm thinking about, or try to read my mind or whatever. And I had to write down actually what I thought, and it seemed really stupid for most of the time, and I was really happy when I was allowed not to do it anymore, because my thought patterns became healthy again. So you have to work, and it is hard work a lot of the times, and sometimes after sessions you can feel worse than you felt before you went there, but after all, it is totally worth it. I was very lucky with my therapist, and she's still my therapist, but I only talk to her when I need to. And the other thing is dialectical behavioral therapy, and it's rather young. I think that it's about 25 years old or so. And it was developed by Dr. Marsha Linehan, and she had borderline personality disorder herself, and she was a psychiatrist by education. So it is basically a combination of kind of Buddhism and cognitive behavioral therapy. And I did some videos on this before, I think 2 or 3. She designed this therapy specifically for helping people with borderline personality disorder to adopt this lifestyle of mindfulness and like emotional regulation and stuff like that, to make these habits part of their lives. And there are a set of useful skills for dealing with your emotions and talking to other people and like other life things. I think that usually it is done in groups, so you go there like once a week or once like in 2 weeks, and you do exercises, and then you go home and practice those exercises. I had not an access to one of those groups, but I was lucky enough to download like a workbook from one of those groups from the internet, and I can actually like put a link for it down below so that you can read it too if you want to. And it was still great because I learned a lot, and I still like go back to it and read it when I have like hard times or when I have a specific problem that I want to address. And it's like my handbook or like my Bible, if you wish. It has really helped me a lot. So I think that if everyone would do this course like in school or like in university, maybe everyone would live a happier life, because it's just like basic life skills and not everyone uses them actually. So go DBT. And the third thing is not less important than the other two, and it is self-care. So it is very, very important to remember to take care of yourself. And if you are diagnosed with borderline personality disorder or like any other mental illness for that matter, you have to first take care of yourself and focus on getting better, and don't worry about like, it's really good if you are privileged enough like I was to like not work for the time when you are in recovery, and to have like family and friends around you who would help you. And I think that this is the reason why for me everything went so fast. So try to be around people who support you and who care about you. And if you can stay like away from work or like studies for some time, I would advise to probably do that. And then eat good, exercise. If you don't exercise regularly, like start small, just start with walks, with little runs, with just a couple of sit-ups or like push-ups, whatever feels good for you. You can do dancing or like swimming, but whatever sport you like. Don't pressure yourself, but be gentle and do something to make yourself feel better. Then try to get regular and enough sleep. I know that this can be very hard because I always, like my entire life, I had problems with sleeping, and it can be draining. Like if you don't sleep enough, it can just drain your energy, and you will not have the strength to fight for your mental health. So try to do that, and take the meds that your doctors prescribe you. I will do like a separate video on meds, I think, because it's just a very big topic that needs to be covered. Stay away from drugs and alcohol. I think that's pretty obvious, but yeah, I will probably make a video on this too. The basic rules of self-care are not there just to like feel your life with discipline or to just, I don't know, annoy you, but they are there to help you, because when you take care of yourself, you kind of build your self-esteem up. So if you have borderline personality disorder, then possibly your self-esteem is somewhere down there, and it's bad, and you have to do something about it. And so the best thing that you can do about it is to take care of yourself and then believe that you deserve it. And then if you have better physical health, then there is less stuff that will distract you from healing and from getting better. So it will make things easier for you in general. And I think that it's very important to just know that you deserve to be taken care of, and you have to be the person who does it for yourself. So I think that this is it for now. And as always, thank you very much for watching my videos, and I love you very much.